If you're over 60, there's a high chance you're doing something every single day that could be silently destroying your joints. These are things that feel harmless, maybe even helpful, but over time, they're wearing down the very structure that keeps you moving and independent. I'm Dr. Karen Holt, a board-certified rheumatologist with over 25 years of experience helping seniors manage and prevent joint damage. Over the years, I've seen far too many of my patients lose mobility, independence, and quality of life because of subtle habits that no one ever warned them about. Joint damage doesn't usually happen in a single moment. It builds up slowly, silently, and by the time pain or stiffness becomes noticeable, the underlying damage can already be severe. In this video, I'm going to walk you through 6 seemingly harmless habits that are secretly harming your joints. We'll count down from number 6 to the single most critical one at number 1, which I urge you to pay very close attention to. It's the most preventable cause of joint damage I see, and it's often ignored until it's too late. Please watch until the end. Recognizing these habits could protect your mobility for years to come. All right, let's begin with number 6 on our list: sitting for hours without movement. Now, I know this one sounds almost too ordinary to be dangerous. You're retired, maybe enjoying a book, a good TV show, or a quiet afternoon at the computer, but prolonged sitting is far more harmful to your joints than most people realize. Many seniors think sitting gives their joints a rest, and it does, briefly. But when you sit for hours without standing, stretching, or walking, the joints in your hips, knees, and even spine become compressed and stiff. Joint fluid, which nourishes and lubricates the cartilage, doesn't circulate properly without movement. Think of your cartilage like a sponge. It needs regular pressure and release, gentle compression from walking or stretching to stay healthy. Without that, it dries out and becomes more brittle over time, making it easier to tear or wear down. In my practice, I've had patients come in complaining of sudden knee pain after doing nothing at all. But upon closer questioning, they've been sitting through long hours, sometimes 6, 7 hours straight, day after day. That inactivity slowly drained their joints of the motion and nourishment they needed. Here's what you can do. Set a simple timer for every 30 to 45 minutes. When it goes off, stand up, walk across the room, do a few gentle heel raises or arm stretches. It doesn't have to be vigorous, just enough to get blood and joint fluid moving again. If you're watching TV, get up during every commercial break. If you're reading, pause every chapter. Keep a tennis ball nearby and roll it under your feet while sitting. Another great way to stimulate movement. Breaking up long sitting periods, even just a few times a day, can make a profound difference in your joint health. Ignore this, and your joints may stiffen faster than you realize. Now, let's move on to number 5. This one's a habit that tricks many seniors into thinking they're being productive when they're actually wearing down their joints. Coming in at number 5 is this: over-reliance on painkillers for joint discomfort. Many seniors reach for over-the-counter pain relievers, like ibuprofen or acetaminophen, at the first sign of joint pain. It's understandable. No one wants to deal with chronic aches, but relying on these pills as your first and only solution is quietly masking damage while allowing it to get worse. Let me be clear, painkillers have their place. They can help reduce inflammation, manage pain, and provide short-term relief, but they are not a fix. And they can fool you into thinking your joints are better, when in reality, the underlying cause of the pain, like cartilage loss or joint misalignment, is continuing to worsen. This is especially true with NSAIDs, like ibuprofen. They reduce inflammation so effectively that patients often return to high-impact activities before their joints are ready. It's like turning off a fire alarm without putting out the fire. I've seen patients who've used daily ibuprofen for years, believing it was keeping things under control. only to later discover advanced osteoarthritis on their x-rays, because the symptoms had been hidden, healed. My advice: use pain relievers sparingly and strategically. If you notice recurring joint discomfort, don't just silence the signal. Listen to it. What activities are triggering the pain? Are you compensating by changing how you walk or move? More importantly, pair any use of medication with a proactive joint health strategy. Low-impact exercises like swimming or Tai Chi, weight management, and seeing a physical therapist if needed. And always consult your doctor if you find yourself reaching for pain meds more than a couple of times a week. Ignoring this point and masking pain might feel like a short-term win, but it's often a long-term loss for your joints. Now, what's number 4? It's a habit that feels good at the time, but it's sabotaging your joint support system. Number 4. Avoiding strength training due to fear of injury. This is incredibly common among seniors, and I understand the fear. When you already have creaky knees or stiff hips, the idea of lifting weights or doing resistance exercises can seem dangerous. But here's the truth. Not strengthening the muscles around your joints is what truly puts them at risk. Your joints are supported and stabilized by muscles. Strong muscles absorb shock, improve alignment, and reduce the pressure directly on your cartilage and bones. When those muscles weaken, every step you take transmits more force to the joint itself. Think of your knee joint as a house and your leg muscles as the foundation. If that foundation starts to crack or shrink, the whole structure becomes more vulnerable to damage. In my clinic, I've seen many seniors who stopped exercising after a mild injury or simply due to aging. Within months, their muscle tone dropped, their balance worsened, and joint pain increased, all because their joints lost crucial support. You don't need to hit the gym or lift heavy weights. Body weight exercises like gentle squats using a chair for support, resistance bands, or even wall push-ups can make a big difference. Start slow, 2 to 3 times a week. Focus on building strength in your legs, core, and back. Consider consulting a physical therapist who can design a routine tailored to your needs. Avoiding strength training might seem like you're playing it safe, but in reality, it's leaving your joints defenseless. Let's keep moving. Number 3 is a bit sneakier. It's something many seniors have been told is good for their health. Number 3, walking on hard surfaces with unsupportive shoes. Walking is wonderful for your health, don't get me wrong. It boosts circulation, strengthens muscles, and supports joint health. But how and where you walk, and especially what you wear on your feet, can make or break your joints over time. The problem? Many seniors do most of their walking on hard surfaces, tile, concrete, hardwood floors, and they do it in slippers, flat sandals, or worn-out sneakers that offer little to no arch support or shock absorption. This might feel fine at first, but over weeks and months, the impact forces from every step begin to travel directly up into your ankles, knees, hips, and even your spine. With age, our natural fat pads, especially under the heels and balls of the feet, thin out, offering less cushion. Combine that with hard surfaces and flat shoes, and you're setting up a perfect storm for joint strain and wear. I've had patients come in with hip or knee pain that turned out to be caused, at least in part, by poor footwear. Once they switched to supportive, cushioned shoes designed for joint health, their symptoms significantly improved. Here's my prescription. Invest in well-cushioned, supportive shoes with proper arch support. Brands that specialize in orthopedic or walking shoes are worth exploring. At home, don't go barefoot or wear flat slippers. Use indoor shoes or slippers that offer real support. If you walk outdoors frequently, try to stick to softer paths like grass or rubberized tracks, and replace your shoes regularly. Even the best walking shoes lose their cushioning after 300 to 500 miles of wear. Supporting your joints begins at your feet. Don't overlook this simple but crucial detail. Next, let's talk about number 2, an overlooked daily habit that quietly grinds down your joints. Number 2, carrying heavy bags or groceries on one side. This is one of the most underestimated sources of joint stress among older adults. You grab your purse, a grocery bag, or even a laundry basket, always in the same hand on the same side. It seems harmless, but the imbalance adds up fast. Here's what happens. Carrying weight on just one side of your body forces your spine, hips, and knees to compensate. Over time, this creates uneven wear, especially in the weight-bearing joints. You may not notice it immediately, but the strain accumulates. Eventually, it can lead to lower back pain, hip misalignment, or worsening arthritis on one side. I've had multiple patients who were mystified by worsening hip or knee pain until we looked at their habits. Many had been carrying the same heavy tote, shoulder bag, or even a grandchild on the same side for years. Here's a better approach. First, lighten your load wherever possible. Use carts or rolling bags instead of carrying. If you must carry, use a backpack with 2 straps instead of a shoulder bag, or switch sides frequently to distribute weight. For groceries, opt for 2 lighter bags rather than 1 heavy one, and carry them evenly. And always be conscious of your posture while lifting or carrying. Keep your shoulders level and engage your core. This small change can go a long way in reducing wear on your joints and preventing long-term imbalances that lead to pain. And now we've reached number 1. This is the single most damaging and most preventable habit I see in my senior patients. And now we've arrived at number 1. This is the habit I see causing the most preventable harm in my senior patients: ignoring early joint pain and pushing through discomfort. Let me be very clear, pain is not weakness. Pain is information. It's your body's way of saying something isn't right. Yet so many seniors have been conditioned to tough it out, to keep going even when their joints start to ache, crack, or swell. That approach might have worked in your younger years, but after 60, ignoring early warning signs is dangerous. It allows minor joint irritation, often caused by inflammation, alignment issues, or early arthritis, to progress unchecked. Cartilage doesn't heal easily once damaged. The more you push through that morning knee stiffness or that dull hip ache after gardening, the more stress you're putting on tissues that are already under strain. In my clinic, I've seen seniors who kept walking for exercise, even as their knees swelled, believing it was good for them. Months later, their joint had degenerated to the point where their only options were injections or surgery. Here's my advice. If you feel joint pain that lasts more than a few days, don't ignore it. Don't rely solely on painkillers to mask it. Start by reducing the activity that triggered it, apply ice or gentle heat as needed, and consider seeing a physical therapist or your doctor. Even better, start a pain journal. Track what hurts, when, and after which activities. This helps you and your healthcare provider detect patterns and make early, effective changes. It's not about stopping movement. It's about listening to your joints and moving smarter, not harder. Ignoring early signs doesn't build resilience. It builds risk. Respect your pain. Treat it as a signal, not an obstacle. So there you have it. 6 habits that might seem minor, even harmless, but can quietly erode your joint health over time. The truth is, joint damage after 60 isn't just about aging. It's about patterns. It's about what we do every day without realizing the long-term consequences. But here's the good news. You have more control than you think. With awareness, you can break these habits and build new ones that protect your joints and prolong your mobility. I've worked with hundreds of seniors who turned things around, not with dramatic interventions, but with consistent, mindful changes. They moved more but smarter. They trained their muscles to support their joints. They listened to pain instead of silencing it. Remember, your joints aren't just what help you move. They're what help you live independently, travel, garden, dance, hug your grandkids. Don't wait until pain becomes limitation. Start now. Your health in your senior years is not predetermined. The choices you make starting today can dramatically alter your future well-being. Which of these 6 habits surprised you most? Or which one are you committed to changing today? Share your thoughts in the comments. I read every one. If you found this information vital, please like this video, share it with a friend, and don't forget to subscribe for more expert-backed health tips for staying stronger after 60. This is Dr. Karen Holt from Stronger After 60, urging you to take these steps for a healthier tomorrow. Stay informed, stay proactive, and take excellent care.